An IME is an insurance medical examination. When your insurance company wants to stop paying your benefits, such as your personal injury protection benefits, they can have you seen by a doctor of their choice. It's an insurance medical examination, IME. Now, the insurance company is going to tell you that it's independent. The I stands for independent. Well, it's nothing of the kind. The sole purpose of the IME is to help the insurance company stop paying your benefits. The insurance doctor is not going to work with your medical team. It's not part of your medical care. As a matter of fact, the insurance doctor will tell you that there is no patient-doctor privilege set up. There is no such relationship. They are there only at the request of the insurance company for one reason only, to help the insurance company deny your claim. They won't tell you they are there to help the insurance company deny your claim, but they know that. Now, I need to clarify this. There are a few doctors who do these IMEs out there who are good. They're credible, they're responsible, and they'll call it straight. But quite frankly, they're in the minority. The vast majority of the doctors are very conservative doctors who maybe they don't like claims in the first place, but for whatever reason, they just don't want to acknowledge that people can be injured or that injuries can continue. And then there are some doctors who are even more extreme. They're simply rubber stamps for the insurance company. So you have to be careful when you go to these examinations, because you have to know what they're all about. That said, the major question is, how do you respond? How do you behave if you're at one of these examinations with the insurance doctor examining you? Real simple solution. Play it straight. Be candid. Don't exaggerate your injuries. Credibility is everything. All you have is credibility. Don't do anything to take away your credibility. If the insurance doctor wants to play games and do things wrong, your lawyer can deal with that. That's your lawyer's job. Your job is to be honest, be candid, play it straight.
There's some really important rules to remember in going to an IME. First, you always want to keep your answers short. You do not want to volunteer information. Look, when we go to see our own doctor, generally speaking, we tell our doctor everything, right? Within reason, because our doctor is there to help us. But when you're going to see an insurance medical exam doctor, that doctor is not there to help you. So the more information you give them, the more you're actually helping the insurance company, as strange as that sounds. So you should always be answering the questions honestly and completely, but you just don't want to be volunteering information that doctors didn't really ask you. Second rule, it's important to never guess. If you don't know an answer to a question, then simply say, I don't recall. If you have an exact answer or an approximate answer, that's great. But if your answer is nothing more than a guess, you should simply say, I don't know the answer to a question. Guessing can actually cause a lot of problems. The third probably important rule to follow in an insurance medical exam is, if you have had any prior similar type injuries, to make sure that you have really thought through, the last 5 or 10 years, have I seen a doctor for any neck or back problems in the past? Sometimes we have I had a client who came in to see me 3 weeks ago to help prepare her for an insurance medical exam. And she had prior treatment, and I said to her, it's really important that when the doctor asks you if you had any prior problems, that you say yes. And it's also important that you let him know what type of problems you're having: frequency, duration, and intensity. That helps the doctor understand what your condition was like before and what your condition was like after the collision.